How to quit smoking if you're pregnant. Are you pregnant and you're concerned about your smoking? Are you concerned about the health of your baby because you smoke? Or maybe you are just interested in learning how to quit smoking because you're pregnant. If that is you, then this video is for you. And make sure you stay to the end of the video because I'm going to give you 4 tips, tricks, and hacks that you can use to quit smoking for the rest of your life. Also, I'm going to put a link in the description below so that you can book yourself into my calendar for a free 15-minute phone consultation. It's easy and it's free, so just take advantage of it. If this is your first time to this channel, make sure you subscribe, especially if you're interested in free tips, tricks, and hacks on how to quit smoking for the rest of your life. For those of you that have gone through pregnancy and managed to quit, please comment in this video in the comment section below so that others can benefit from your experience. Or if you yourself are pregnant right now and you're trying to quit and you're struggling, post about it in the comment section below. That's the whole point of the comment section of the video. So please feel free to post whatever you need to and ask any questions. So let's hop right into the content. Quitting smoking when pregnant. Let's start with the why before we get into the how. Now, the why is pretty self-explanatory. We all know, we almost know intuitively that smoking while pregnant is not a good idea. But let's just deconstruct this a little bit, okay? So that we can kind of get into the weeds of it. When you smoke when you're pregnant and you have a fetus inside your belly, when you smoke every cigarette, it's literally, according to science, equivalent to putting your baby in a smoke-filled room for 15 minutes per cigarette you smoke. Here is why. What happens when you smoke, you are ingesting over 4,000 chemicals. Of those 4,000 chemicals, over 100 are known to be carcinogenic. And the way that those chemicals get ingested and move around your body is through your bloodstream. Well, if you're pregnant with an unborn baby, guess who shares your blood with you? Your unborn baby. So whatever you ingest, your unborn baby ingests. And that is a problem. So let's look at some of these chemicals that we ingest. Some of them are, but not limited to, because I'm not going to name off 4,000 chemicals here: ammonia, arsenic, cadmium, formaldehyde, lead, tar, and many, many, many others. That was literally just me naming a few of those 4,000, of which we know 100 are carcinogenic. And remember, what you ingest, your baby ingests, because those chemicals get filtered through your bloodstream, which you share with your unborn baby. Now, here's what else we know from science. We know that there's a connection between smoking when you're pregnant and birth defects, low birth rate, neonatal death, sudden infant death syndrome, miscarriages, stillbirths, placenta issues, colicky babies, asthma in young children, and childhood obesity are all linked to parents who smoked while pregnant. So I'm not going to go on about all the things that you need to know about the ill effects of smoking while you're pregnant, because we pretty much know all these and we know them intuitively. So just one last thing I want to do before we get into the 4 hacks, because we pretty much understand why it's not a good idea to smoke while you're pregnant, right? So let's just look at some of the benefits if you do quit before we get into how to quit. So the first thing is, as soon as you quit smoking when you're pregnant, within 20 minutes, literally within 20 minutes, you start to see positive effects from quitting. Your blood pressure drops to normal within 20 minutes, because when you smoke, it's a heart stimulant. Nicotine is a heart stimulant that stimulates your heart, makes it beat 6 times more per minute, and causes your stomach to create additional stomach acid. It stresses your system. So as soon as you stop, within 20 minutes, your blood pressure starts to normalize. Within 24 hours, your chances of having a heart attack literally go down. Within 2 weeks to 3 months, your blood circulation improves, which helps tremendously with the birthing process. If you go 1 year, your risk of heart disease is cut in half. 5 years, your risk of stroke goes down significantly. 10 years, your risk of dying from lung cancer or heart attacks is cut literally in half. And if you make it 15 years, your risk of heart disease is literally the same as a non-smoker. There are tons of benefits to quitting smoking, and you feel them almost immediately. And this is true not only for pregnant smokers, but for any smoker. But let's just look at the benefits for a pregnant woman if she quits smoking. Here is what happens to a woman who is pregnant that quits smoking. We know it immediately lowers your chance of birth defects, low birth rate, neonatal death, sudden infant death syndrome, miscarriages, stillbirths, placenta issues, colicky babies, the child developing asthma, childhood obesity. Notice any similarities between the list of what happens if you smoke and the benefits of not smoking? It's exactly the same. The benefits of quitting smoking when you're pregnant are immeasurable and massive both to you and to your unborn baby. Quitting smoking while pregnant is the number one thing anyone can do to prevent all of those issues I listed. So clearly quitting while pregnant is obviously the right decision. It's often easier said than done. So let's go through 4 tips, tricks, and hacks specifically designed to help pregnant women quit. Keep in mind that if you're serious about quitting smoking while pregnant, that it's best to do it with the aid of a program, as this gives you the best chance of being successful in your quit attempt. 93% of all people who quit permanently do so with the aid of a paid program. So let's hop into tip number 1. Tip number 1 is find the motivation, or find what I call your inception point. And here's what I mean by that. In order to do anything or accomplish anything in life, we actually require 3 things. 3 things are required. And I like to kind of describe this as it's like walking out on a diving board and you get to the edge and you got to jump into the pool. The jumping into the pool is the doing of something or accomplishing of a goal you set out to, like quitting smoking. So to get to that end of that diving board, or that inception point that I'm describing, you have to have these 3 qualities. 1, you have to believe something has to change. You have to believe that your habit has to change. If you don't think that you have to quit smoking because you're pregnant, you're likely not going to. You need to have that. You have to believe something has to change. The second thing is you have to believe that that something must be me. So you have to believe it's you that has to change. I must change. And the third thing is when? Now. So the 3 things you need to have to change any behavior in your life, like smoking, is you have to believe something has to change. So you've got to believe that you need to quit smoking, that something has to be you, and it has to happen now. If you have those 3 things, you are at the edge of the diving board. You need to then just jump. You need to just quit. And we're going to talk about how to do that in tip number 4. But let's just go to tip number 2 now. So the next thing you have to do once you kind of get yourself to the edge of that diving board and that inception point is you have to prepare and plan. Failing to plan to quit smoking is planning to fail. You have to actually plan. Just waking up one morning and going, I'm going to quit, is not planning to quit, because you want to prepare for things like withdrawal, with cravings, with stress, because these are all the things that cause people to fail. So you need to plan for them. As soon as you start doing that, you start planning, your chances of success go up immeasurably. The next thing you want to do in this prepare and plan is you want to learn from other people that have experience. So go download an ebook. There's tons of them. There's one on my website, an ebook on how to prepare your mind for quitting smoking. They're free, and lean on other people that have been through this. So that's tip number 2, plan and prepare. Tip number 3, learn how to deal with cravings. Here is why. Because the number 1 reason why people quit and then fail is they don't plan for the cravings. So I'm going to give you 6 different methods that you can use. I'm not going to explain them, but just know that there's lots of ways to deal with cravings. 1, the exercise model. Okay, there is a whole model about how to deal with cravings by getting up changing your situation and moving your body. It's very easy to Google it and find these methods. 2, the de-stress method, learning how to deal with stress and anxiety when we get a craving. Number 3, the timer method. That's simply where you set a timer for 15 minutes and then you do not smoke for that 15 minutes, and chances are the craving will pass. 4, the oral or hand method. That has to do with people that have this fixation of putting something in their mouth constantly. There's a whole method about dealing with those cravings. There's something called the triggerless method, which is simply put, every time I have a coffee, I smoke, and so when I'm having my coffee, I think of a cigarette and I get a craving. So it's learning how to deal with the triggers. There's a whole method that's designed around how to deal with that. 6, use a meditative or a focus method, which is another way to deal with cravings. So that's tip number 3, learn how to deal with cravings. Tip number 4, and this one is self-evident, pick a method. There are 12 known ways in science to quit smoking. There's really just 3. Ways that are designed for your conscious mind, ways that deal with it as an addiction, and ways that deal with it as your unconscious mind. So, conscious mind ways are things like the books, the apps, cold turkey. Addiction is nicotine replacement therapies, so the gum, the patch, the lozenge, the drugs, the Zyban, the Chantix. And unconscious mind methods are things like hypnosis, EFT, NLP. Okay, so there's 3 different known ways. Here's my advice when you pick a way. Pick a way that utilizes stacking. Now there's a video link I'll put here for you that explains to you what stacking is. But essentially stacking operates on the premise of, why am I just doing one of the 3 ways? Why am I just reading this particular book? Or joining this Facebook group, or I'm just doing cold turkey? Or why am I just doing the patch? Or why am I just doing hypnosis? Stacking is stacking all 3 of those ways together into a single method. So my advice is, if you want the greatest chance of success in quitting smoking, use the stacking method and watch the video link in here to what the stacking method is. So again, if this is your first time to this channel, please subscribe, especially if you're interested in tips, tricks, and hacks on how to quit smoking for the rest of your life. I've also put a link to my calendar so you can book yourself into a free 15-minute phone consultation. Take advantage of it. And also, if this has worked for you in the past, or you've done something different, let others benefit from that and put a comment. Or if you have questions and you want more information, put your question in the comment section of this video. That's the whole purpose of the comment section. Thank you very much for your time and attention. Blessings to everyone, and I'll talk to you soon.